Imagine something so pervasive, yet so hidden, it costs the U.S. agricultural industry over $1 billion every single year. We're talking about these invisible poisons that silently undermine our food supply and the very health of the animals we depend on. They just profoundly complicate agricultural productivity.
It's truly an insidious threat because the signs, well, they often mimic other more common illnesses. It makes them incredibly difficult to pinpoint until the damage is already pretty significant.
And that's the core of the challenge we're diving into today: mycotoxicosis in cattle. Now, this isn't just some clinical term, it's actually a whole range of serious diseases caused by mycotoxins. These are potent poisons produced by common molds that contaminate animal feed. Think of this deep dive as your shortcut to truly understanding a pervasive, often overlooked, but really critically important challenge in animal agriculture. Our mission here is to uncover the silent nature of these toxins, explore why they're so difficult to detect, and reveal their far-reaching economic and health impacts. Hopefully, you'll walk away with a truly well-informed perspective.
Yeah, exactly. We'll start by defining what mycotoxins actually are, where they come from, and then we'll walk you through how they specifically harm cattle. From there, we'll tackle the frustrating challenges of diagnosing them and, crucially, shift our focus to effective prevention and management strategies. And like you said, the economic consequences alone are just staggering.
Okay, so let's unpack this. To begin, what exactly are we up against here? What is this enemy?
Well, the enemy, mycotoxin, literally means poison from a fungi. These are toxic compounds, specifically secondary metabolites, basically,
Hmm.
harmful byproducts produced by certain types of molds. The primary culprits in cattle feed are often from the Aspergillus, Fusarium, and Penicillium genera. These are molds you might even see sometimes, but their real danger lies in these invisible toxins they produce.
Right, and what makes them so insidious, you mentioned the illness they cause, mycotoxicosis, is frequently silent. The clinical signs are often nonspecific, which makes early detection incredibly difficult. I mean, a feed batch can look perfectly normal, smell fine, and yet be heavily contaminated with mycotoxins.
That's absolutely right. It's not uncommon for severe outcomes, even death, to occur without any clear diagnosis of an infectious disease. Just seems like the animal got sick. And adding to the challenge, mycotoxins are chemically stable. They can persist through various feed and food processing operations, even things like heat, pelleting, or ensiling. Once they're in the feed, they're generally there to stay.
And what's particularly tricky, you mentioned, is that mycotoxins aren't uniformly distributed within feed batches. It's like hidden pockets of danger. They create hot spots, right? These localized areas of intense fungal growth. So this means you could test one part of a batch and find nothing, while another section is, heavily contaminated. The core insight here is that a single scoop might give you a false sense of security, or maybe a clean test doesn't necessarily mean the whole batch is safe.
Exactly. Which brings us to where they come from. Contamination can happen either pre-harvest, right there in the field, or post-harvest during storage.
And I understand there are specific risk factors that really set the stage for fungal growth and toxin production. We're talking about things like wet or humid growing conditions, maybe a delayed harvest.
Insect damage is a big one. Physical damage to the plants themselves, improper drying that's crucial, and of course, inadequate storage. High moisture, warm temperatures, perfect breeding ground.
And when we connect this to the bigger picture, climate change seems like it presents a pretty significant emerging challenge here. It's projected to alter weather patterns, more frequent droughts, maybe increased humidity, temperature shifts.
Yeah, and these conditions directly correlate with plant stress. They create ideal environments for an increased prevalence, wider geographical distribution, and potentially higher concentrations of mycotoxins in our feedstuffs. This is an issue that's almost certainly going to grow in importance.
Okay, so given those perfect storm conditions for mold growth, which specific villains are we typically up against? Let's meet this. Rogues gallery, so to speak. You said hundreds exist, but a select few are the primary concerns in cattle, each with its own distinct impact.
That's right, starting with aflatoxins, or AFs. These are primarily produced by Aspergillus flavus and Aspergillus parasiticus. You commonly find them in corn, peanuts, cottonseed, other cereal grains, even sometimes in hay.
And these are considered among the most poisonous, right? They primarily hit the liver hard, causing significant liver damage, things like jaundice, hemorrhages, fatty accumulations. They also cause immunosuppression and are carcinogenic. The critical concern for you, the listener, is that aflatoxin M1, or AFM1, can actually be excreted into the milk of dairy animals. That's why we have strict regulatory limits, like those from the FDA, to protect human consumers.
Absolutely. Next up, we have zearalenone, or ZEN. This one's produced by Fusarium species. Its key sources are things like corn, barley, wheat, oats, rye, and also silage.
And ZMN has potent estrogenic effects, doesn't it? Leading to significant reproductive issues. We're talking reduced fertility, irregular estrous cycles, swollen vulva, even sterility in male animals. It can also decrease milk yield and quality. But a crucial distinction here, often misunderstood, I think, is that zearalenone does not cause abortions. That's a different issue.
Correct. That's an important point. Then we have fumonisins, or FUM. These are predominantly found in corn crops produced by Fusarium verticilioides and Fusarium proliferatum. Their main impact is liver and kidney toxicity and also reduced growth.
Now, here's something that sounds like a hidden danger in modern agriculture. Fumonisins and other mycotoxins, too, can become highly concentrated in dried distillers' grains and solubles, or DDGS. That's a common co-product of ethanol production.
Yeah, that's a really important factor. The ethanol process, it extracts the starches from the grain, but the mycotoxins, they're left behind. They don't ferment, so they effectively get concentrated. This means even moderately contaminated grain, when it's processed, can yield significantly higher, potentially toxic mycotoxin levels in the resulting DDGS. It creates this kind of amplified risk pathway, a real challenge for feed formulation.
Definitely sounds like it. Okay, what's next on the list?
Trichothecenes. This is a group that includes deoxynivalenol, or DONON, often called vomitoxin and T2 toxin. These are produced by Fusarium species as well, and found in cereal grains like barley, corn, oats, rye, and wheat.
Okay, vomitoxin, that name gives it away. Known for causing feed refusal, vomiting, reduced feed intake, and gastrointestinal lesions, I assume.
Exactly. And T2 toxin, well, that was considered highly toxic for ruminants. It causes potent cytotoxic and immunotoxic effects, tremors, paralysis of hind limbs, and really widespread damage to the GI tract, blood vessels, heart, nervous system. In severe cases, T2 can even lead to abortions and increased mortality. So, quite nasty. Wow. Okay. What else? Ergot alkaloids. These are produced by claviceps species, which infect grains and grasses, including fescue grass, that's a common one. Their impact is primarily seen as vasoconstriction narrowing of the blood vessels. This leads to gangrene of extremities like tail tips and feet, along with poor growth, reduced milk production, and reproductive problems. Sort of like frostbite, but from the inside out.
Grim. Okay, one more.
Ochratoxins, produced by Aspergillus and Penicillium species, commonly found in cereals and even coffee beans. These primarily cause kidney damage or nephrotoxicity and also immunosuppression.
So many different toxins, different sources, different effects, but you mentioned something earlier that sounds really crucial, the challenge of co-occurrence.
Yes, this is where it gets really interesting and complicated. It's incredibly common for multiple mycotoxins to show up in feed together. You see, molds often produce more than one type of toxin, or you might have different mold species contaminating the same feed batch.
And when multiple toxins are present, they can interact in complex ways, you said additively, or synergistically, basically amplifying their overall toxic potential. So the core insight here is that you can't just think about one mycotoxin in isolation. It's the cocktail effect that dictates the true risk. Right.
Precisely. And this often means that even if the levels of individual mycotoxins are technically below regulatory limits, their combined effect can still cause significant health problems. It makes diagnosis and risk assessment much, much more difficult for vets and producers.
Okay, so with all these different mycotoxins floating around, possibly in combination, how exactly do they wreak havoc inside an animal's body? What's the mechanism?
Well, once they're ingested, mycotoxins are absorbed from the gastrointestinal tract. From there, they travel through the body and exert their toxic effects on various organs and systems.
And one of the key pathological mechanisms you mentioned is widespread immunosuppression. That sounds pretty significant.
It really is. Many mycotoxins, aflatoxins, ochratoxin A, trichothecenes like DON and T2, fumonisins, they all significantly impair immune function. This dramatically reduces an animal's ability to fight off secondary infections, think pneumonia, mastitis, things like that. And it can even diminish the effectiveness of vaccines.
So a seemingly unrelated illness, or maybe a vaccine just not working as expected, might actually have mycotoxicosis as an underlying cause. It's predisposing the animal to other diseases. That sounds like a huge hidden cost for producers.
It absolutely is. Beyond that immunosuppression, mycotoxins commonly target and damage the liver and kidneys, leading to dysfunction. We also see reproductive dysfunction, primarily linked back to zearalenone and T2 toxin, and even neurotoxicity, where some mycotoxins directly affect the nervous system, causing weakness, incoordination, or maybe even paralysis.
Now, when it comes to ruminant susceptibility, you said it's a bit complicated. Ruminants are generally considered less susceptible than monogastric animals, like pigs or chickens. Why is that?
It's because their rumen microbiota, the microbes in their first stomach compartment, have some pretty amazing detoxification capabilities. They can break down certain mycotoxins before they even get absorbed.
Ah, okay. But it's not foolproof.
No, definitely not.
Yeah.
This ruminal degradation varies significantly. It depends on the specific mycotoxin type, the concentration, whether other toxins are present, that co-occurrence thing again, and how long the animal is exposed. And this raises an important question. Who is most susceptible within the herd?
Right.
Well, young, immature animals, like calves, their rumens aren't fully developed yet. And animals in specific physiological states, like transition cows, those cows right around calving time, they're under a lot of stress. So these groups are often more susceptible. Their rumens might not be working at full capacity, or their overall stress just compromises their resilience. So while an adult cow might tolerate a certain level, the most vulnerable animals on the farm could be severely impacted.
That makes sense. And the general clinical signs of mycotoxicosis really highlight why it's so tricky. You said reduced feed intake, poor growth, weight loss, decreased milk production, maybe a rough hair coat, and that increased susceptibility to infections because of the immunosuppression. It all sounds very nonspecific. If you see those signs, mycotoxins should definitely be on your list of possibilities, but they could be caused by lots of things.
Exactly. Which leads us to diagnosis. Cracking the case of mycotoxicosis is genuinely difficult. As we've discussed, the clinical signs are nonspecific, and the mycotoxins aren't evenly distributed in the feed. And you absolutely cannot rely on visible mold to tell you if there's a problem or not.
Right. The absence of mold doesn't mean the absence of toxins, so a definitive diagnosis requires a multifaceted approach then, combining clinical observations, maybe postmortem findings, and most critically accurate lab analysis of both feed and maybe animal samples too.
That's the ideal, yes.
Yeah.
Feed analysis is truly the gold standard here. Testing feed samples for the presence and concentration of mycotoxins is the most reliable method we have.
And why it matters so much is getting the sampling right. That's absolutely paramount because of that uneven distribution, those hotspots we talked about. So for harvested grain, I think the recommendation is to collect at least 10 probes from various locations or from a moving stream, aiming for a decent-sized sample, maybe 10 pounds.
Correct. Or for ear corn, maybe 30 to 50 ears from different spots in the field or bin. And there's specific ways to handle dry versus wet feeds to make sure the sample stays representative and doesn't degrade further. Essentially, good sampling is your first and maybe most critical line of defense in getting an accurate picture.
Okay, and what about the actual testing methods in the lab?
Well, there are rapid screening methods like ELISA tests. They can give you a quick idea, but it's crucial to note that the old black light test for aflatoxins is highly unreliable. It gives frequent false positives or negatives because it's just looking for a related compound, not the toxins themselves. For accurate, selective, and sensitive results, you really need the conventional confirmatory methods like HPLC or LC-MSMS. Those are the gold standards in the lab.
Gotcha. And while the clinical signs are nonspecific, those observations, especially when combined with a history of feeding suspect feed, they're still crucial for raising suspicion in the first place, right? And lab data from the animals themselves can support the diagnosis, like blood tests showing elevated liver or kidney enzymes, or maybe testing urine or milk for specific toxins like aflatoxin M1.
Yes, exactly. Those pieces help build the picture. And finally, a post-mortem examination, especially in acute cases where an animal dies suddenly, can provide valuable pathological evidence. It might reveal those organ-specific lesions like liver necrosis, kidney damage, or gastrointestinal ulcers that point towards mycotoxins.
Okay, so diagnosis is tough, but possible with the right approach. How do we shield the herd? How do we prevent this in the first place? Prevention sounds absolutely key here.
It is. Since there are generally no specific antidotes for mycotoxicosis, preventing exposure is paramount. And this is a multifaceted challenge. It requires a comprehensive management program that starts with crop production in the field and goes all the way through to feeding the animals.
So pre-harvest and harvest strategies, what does that involve?
It involves careful agronomic practices, things like precision farming, trying to minimize physical damage to the crops during growth and harvest, and timely harvesting, not letting crops stand too long, especially in wet conditions. There are also some emerging biotechnologies, like using biocompetitive fungi, basically good fungi to outcompete the bad ones, and ongoing research into developing host plant resistance, so breeding crops that are naturally less susceptible to mold.
And then post-harvest and storage management must be absolutely crucial too.
Hugely important. Rapid drying of grains down to below about 10–13% moisture is essential, and you have to maintain that low moisture during storage. Any moisture getting back in can allow molds to regrow.
Makes sense. What else for storage?
Well, just basic good management. Cleanliness of storage bins, proper temperature control if possible, adequate aeration to keep moisture and temperature even, and effective pest control insects can damage grain and create entry points for mold. For silages, ensuring effective air exclusion, packing it tight, and rapid ensiling helps promote the right kind of fermentation. But it's important to note, though, that while acid additives can control new mold growth, they do not destroy preformed toxins that are already there. And just following a simple first-in, first-out principle helps reduce storage time and the opportunity for mycotoxin development in stored feeds.
Okay, but what happens when you do find contaminated feeds? The safest route is obviously to avoid them entirely, but you said that's often not feasible for producers, so what then?
Right, it's often an economic reality you have to deal with. This is where regulatory limits, like the FDA's advisory levels, come into play. They give guidance on maximum tolerable levels. A practical solution, often used, is blending contaminated feed with clean feed to dilute the overall concentration down below those advisory levels. But you have to be really careful doing this to prevent further mold growth in that blended feed and make sure it's mixed very thoroughly. Diversion to less susceptible species is another option, sometimes maybe feeding it to beef cattle instead of dairy cows. But again, you have to be cautious to avoid residues ending up in food products like meat.
And what about mycotoxin binders? We hear about those quite a bit.
Yes, binders. These are substances, often clays or yeast cell wall extracts, that are marketed to bind mycotoxins in the animal's gut and reduce their absorption into the bloodstream. However, here's an important caveat for you. No single binder is effective against all mycotoxins. Some work better for aflatoxins, others might have some effect on zearalenone or fumonisins, but none get everything. They can also sometimes bind essential nutrients, like vitamins and minerals, which isn't ideal and can add to the cost. And in the U.S., they technically aren't approved or regulated as mycotoxin binders. They're usually marketed as flow agents or feed additives that might enhance performance. So generally, a preventive approach is much preferred over relying solely on binders. They're really more of a risk mitigation tool to use when you suspect a problem, rather than a guaranteed cure or prevention method.
Okay, that's a really important clarification. So prevention is key, mitigation tools like binders exist, but what happens when things do go wrong? What's the treatment? Is there a magic bullet?
Unfortunately, no. There's no magic bullet. There are generally no specific drugs or antimicrobials that can directly counteract the effects of the mycotoxins themselves once they've been absorbed.
So what can you do?
The primary most effective action is simply the immediate removal of the contaminated feed source. Get it away from the animals as quickly as possible. Stop the exposure.
And beyond that?
Beyond that, it's really about supportive care, providing high-quality, easily digestible nutrition to help the animal recover, maybe liver support supplements, and potentially antimicrobial therapy if secondary bacterial infections have set in because of the immunosuppression. Good general nursing care is also vital, keeping animals comfortable, hydrated, etc.
And what's the prognosis? If you catch it and remove the feed, do they recover?
Well, the prognosis is variable. It really depends on which mycotoxin was involved, the concentration they were exposed to, how long they were eating it, and how quickly the problem was identified and the feed removed. Recovery can be prolonged, especially if there's significant liver or kidney damage. And unfortunately, severe cases, particularly with toxins like T2 or high levels of aflatoxin, may cause permanent damage, and those animals might never return to their previous production levels.
Wow. Okay, which brings us inevitably to the bottom line, the economic impact.
Yeah.
You mentioned over $1 billion annually in the U.S. alone. How did these invisible toxins actually hit farmers directly in their pockets, and what's the broader economic ripple effect?
Yeah, the bottom line is the economic impact is just profound and multifaceted. That billion-dollar estimate might even be conservative. It impacts the entire food and feed supply chain, from the grain farmer to the livestock producer to the consumer.
So directly for grain farmers, we see a reduced crop value if tests show contamination, outright rejection of commodities at the elevator, and just generally lower prices for contaminated grain, right?
Exactly. And globally, stricter international limits, like the EU's very tight 4 parts per billion limit for aflatoxins in food, can lead to substantial export losses for grain-producing countries, especially developing nations. And sometimes, tragically, this even forces those countries to retain the contaminated grain for domestic use, which just exacerbates human health risks within their own populations because they can't afford to destroy it or find alternative uses.
That's a sobering thought. And for the livestock producers themselves, the losses in animal productivity directly hit their profitability, don't they?
Oh, absolutely. It's a constant drain. Reduced weight gain in booth cattle, impaired feed conversion efficiency, meaning they eat more feed for less gain, or milk, decreased milk production in dairy cows, impaired fertility leading to fewer calves or longer calving intervals, and that increased susceptibility to disease, which means higher vet bills and medication costs. And yes, in severe cases, even direct mortality, losing the animal entirely.
And the impact doesn't stop at the farm gate. There are significant human health costs, too.
Yes, both from direct consumption of contaminated crops, which is a bigger issue in some parts of the world than others, or indirect exposure through animal products, like that aflatoxin M1 we discussed ending up in milk. Mycotoxins are linked to a range of adverse health effects in humans, including various cancers. Aflatoxins are strongly linked to liver cancer, maybe esophageal cancer too, and other chronic health issues. This leads to significant healthcare costs and lost productivity in affected populations.
And there are even broader implications, I imagine. Costs for implementing prevention strategies, for all that sampling and testing we talked about, potential litigation, funding research.
Precisely. And circling back to that DDGS concentration problem from ethanol byproducts, that creates new economic challenges too. It can amplify mycotoxin levels in what should be a valuable protein-rich feed ingredient, sometimes making it unusable or requiring expensive mitigation strategies like using higher levels of binders, further adding to feed costs.
So as we wrap up this deep dive, it's just incredibly clear that mycotoxicosis is this complex, pervasive, and often really hidden threat. But understanding its mechanisms, its widespread impacts, and the absolutely crucial role of prevention is vital for agriculture, for animal welfare, and ultimately for human health.
It truly is. And given the invisible nature of mycotoxins, their widespread impact, the increasing challenge of co-occurrence, and the growing influence of climate change on their prevalence, it really makes you wonder, what future innovations do you think will be most transformative in safeguarding our feed supply, animal health, and ultimately global food security in the next decade? Maybe it's in rapid on-farm detection technologies, or perhaps genetically engineered mycotoxin-resistant crop varieties. It's certainly a topic that's going to demand continued innovation and vigilance.